Joining us now, South Dakota Senator John Thune, a Republican and member of the Senate Commerce Committee. Senator, thank you for joining us today.
Good afternoon, Jamie.
It is a rare session. It is a busy session, and there's a lot being bantered about. And now we got word about an hour ago that President Obama will visit the Hill on Sunday to kind of move things along, he hopes. There is a lot of pressure to get this bill done by Christmas. How do you think it's going, and do you think in these closed-door sessions that we know are going on that the Republican ideas, the GOP ideas, are making it into those discussions?
I don't think any of the Republican ideas are making it into the discussions currently. They certainly weren't before. The bill that we have on the floor, the 2,100-page monstrosity, was written behind closed doors, and it did not include any Republican ideas. I think the reason they're trying to move this so quickly, Jamie, is they want to get it behind them because they know the more that it is exposed, the more the American people are opposing it. And of course, we're seeing that, we're hearing that from our constituents back home, and I'm sure that they are too. And when people realize that this is a $2.5 trillion expansion of the federal government that cuts Medicare, raises taxes, and for 90% of Americans, their premiums stay the same or go higher, and it still doesn't cover 24 million Americans, that most people are going to say that's not reform. It certainly isn't the reform that we're for, and I think the president's probably going to have to come up here to try and bend some arms to try and get those last few Democrats to walk the plank and support this thing. But it's bad policy for America, and we're going to do everything that we can to stop it.
One of the concerns for older Americans certainly is the cuts to Medicare and overall really the ability to pay for the bill that is currently being discussed. What points would you like to make about how realistic it is to get this health care in its current form done by that time frame and to be able to pay for it?
I think the real challenge that they have, they're going to try and get it done before the end of the year, of course, and they're going to try and jam it through. They're going to try and rush this, and they're going to, like I said, there's going to be a lot of arm twisting that goes on over the course of the next several days. But they have a big problem because it does cut Medicare by $500 billion in the first 10 years, and in the two-decade time period by $3 trillion. It raises taxes in a 10-year time period when it's fully implemented by over $1 trillion. And the ironic thing about all that is it doesn't do anything to impact premiums for 90% of Americans. 90% of Americans are going to have their premiums stay the same. That is, can keep going up at the rate they've been going up, which is about 6% a year, or see their premiums go up. If you're in the individual marketplace, your premiums are going to go up 10 to 13%. So, like I said, I think that they've got big problems trying to rush this thing through, and I think the more the American people understand what's in it, the more they're going to be contacting members of Congress and members of the Senate today and letting them know that they want them to vote against it. But they're going to do everything they can to push this as fast, as quickly as they can. We want to do everything we can to have an opportunity to debate it, which we're doing today. We're obviously debating amendments, but I think the more that Republicans are able to get the story out about what this bill includes, the more likely it is that Americans are going to turn even increasingly against it, and we believe they already are overwhelmingly against it.
Well, Senator Cardin was on, and we talked to him about some of his thoughts. I want to ask you about one of those amendments Blanche Lincoln is proposing, and I'm just reading some of the things that she wants about executives, insurance companies, specifically executives' compensation limited to what the president makes, about $400,000. Is that something that you think would be useful in curbing costs? I'd like to ask you about that first, and then I also want to ask you about preventative care, which is on the minds of many Americans.
Well, in response to your first question, the Lincoln Amendment is obviously designed to punish insurance companies, and what's sort of interesting about it is that she singles out one industry. There was an interesting exchange on the floor this morning where Senator McCain asked for unanimous consent to have her amendment include AARP, which, by the way, is one of the 5 largest companies in the country that offers insurance, and to cover Walmart too, which also provides health insurance coverage, and they objected to that. So it's clearly a political stunt. There isn't anything serious about this in the long term. That isn't going to do anything to impact the cost of health care, but they're trying to do this for political theater. But the interesting thing about it today is I think it got turned on them when somebody suggested that it ought to cover some of their allies in this, and they rejected that. So
and preventative care, Senator, before we go?
I think preventive care is something that we all believe we need to do. We ought to be doing things to promote wellness, to do chronic disease management. There are lots of things that I think we could agree upon. That is some common ground. What we need to do is to defeat this and then hopefully start over and do this step by step. And we could do some wellness, and we could do some interstate competition and some tort reform and some small business health plans, all of which would drive down health care costs in this country. None of what's included in this bill has any impact on that. And we're going to spend trillions of dollars and create 70 new government programs, and at the end of the day, 90% of Americans are going to have the status quo. That is, their premiums are going to stay the same or go higher.
Senator John Thune, we thank you so much for joining us.